Hi, I'm Dr. Anais, bariatric physician, and today I'm going to teach you how to measure your body circumference so you can use that to evaluate your bariatric process, okay? So now we have a patient actually just recently had surgery, and she's going to help you to show us how we are going to measure your body circumference. Okay, so right now I'm going to start explaining you how you need to measure your waist circumference. First, I'm going to ask you to put your arms like this, okay? So, for the waist circumference, you need to locate the narrowest part of your torso, okay? So that will be located under the last rib, between the last rib and the upper part of your iliac crest, okay? So the iliac crest is the bone over here, and the lowest the last rib should be located in that area, okay? So I'm going to ask to the patient to take a deep breath, and then I'm going to try to locate the waist, okay? So take a deep breath, please. Exhale. Okay. So now that I locate the waist, I'm going to start, I'm going to put the tape measure over here. Make sure you don't put a lot of pressure on the skin, okay? And where the 0 is located, that will be the measurement of the waist, okay? In this case, is located on 77 centimeters, okay? 27 inches. Okay, so now we're going to continue measuring her hip circumference. For that, I'm going to ask you again to put your arms over here because for me it's easier to have free this area. So for the hip circumference, the whole purpose is to try to locate the greatest circumference of the greatest gluteo, okay, or her buttock. So in this case, I will start measuring. So again, make sure you don't put a lot of pressure. We don't need that. We only need to actually mark the greatest part of her hip, which in her case is 47 inches. So now we're going to continue measuring her mid-upper arm circumference, okay? For that, I will only ask her to relax her arm, okay? Okay, so for the mid-upper arm circumference, we're going to first locate the tip of her shoulder and the tip of her elbow. And we're going to measure right here, okay? So from the tip of her shoulder to the tip of the elbow, and we are going to put a mark halfway, okay? Which means that that is the place of the mid-upper arm circumference. In this case is 16 inches, which I'm going to locate her mid-upper arm circumference on the 8, okay? So once we have the halfway measurement, okay, so relax. Then the arm needs to be hung down and relaxed, okay? So I can take the measurement, and in her case, the measurement is 13.8. So right now what we're going to measure is her neck circumference. In this case, we're going to try to locate just in the midline of the neck, okay? In the case that is a man, it is easier because we can locate the Adam's apple. In her case, I'm going to try to touch right here where the higher bone is located, and I'm going to put over there the tape measure. 14.6 inches. Okay, so now we're going to measure her resting circumference. I'm going to ask her to relax her arm in this position. Okay, relax, relax, relax. I'm going to take it in this position. And I'm going to put in this way the tape measure. And the mark says 7 inches in her case. Okay, so now we're going to measure her leg circumference. First, I'm going to ask to the patient to take a seat over here, please. I'm going to do it with you. You're going to put your leg like this, so you need to be relaxed, okay? Again, here we are going to try to locate the hip and the knee, okay? We're going to measure from here to the tip of the knee, and again we're going to put a mark halfway, which in this case is 8. Okay, so here where I located the halfway, I'm going to 22.7 inches. Okay, so with this we finished the body circumference that we use to evaluate the bariatric process. So thank you, Gigi, very much for being my model. And remember, these are the measurements or the circumference that I will request monthly after your surgery to see how are you doing. Remember that I mentioned the weight or the scale number, it's not the only parameter. So the circumference are very helpful for me to see how are you doing after surgery. Thank you.
You're welcome.